Everybody, Dr. Rob here live. We're going to talk about the pleiotropic effects of a low-carb, high-fat diet. So what I really mean to say is I want to share all the positive outcomes when you switch to a low-carb, high-fat diet. Pleiotropic means that it has multiple effects on different pathways or different genes. That's how powerful a low-carb, high-fat diet, sort of like a ketogenic diet. Everybody knows, I've lectured many times on ketogenic. Ketogenic is a 75% intake in calories from fat, approximately 20% intake of calories from protein, and 5% calories from carbohydrates. So really, without question, these low-carb, high-fat diets are critical, keto being one of the better ones, without question, if not the best one. In addition to all that, the reason that you have that is ketogenic diet makes ketone bodies. Ketone bodies, as you'll see, are a critical element. The big ketone body that's made is beta-hydroxybutyrate. So we'll show all the positives that beta-hydroxybutyrate have. Many people say, I don't know about this high-fat, low-carb. There's a question already that we just got in. The question is, how long can you stay on these high-fat, low-carb diets? Well, bottom line is you can stay on them for a long period of time. If you want to transition off or you feel the need to, you can, but you don't have to, because there's no literature that if you eat a good high-fat diet or a clean high-fat keto diet that you have to get off, because it's really carbohydrates that pose the health condition or health conditions and or trans fats, something like donuts and French fries and the such. So that's one of the questions we already got that I wanted to address right away. So bottom line, let's take a look at an increase of ketone uptake. This ketone uptake, you're going to have positive effects to the brain, heart, and the muscle. Muscle really has shown, there was an article that just came out that shows that not if you go a high-fat, low-carbohydrate diet, you can actually lose weight in athletic performance, yet still generate as much power. So it was shown in powerlifters and Olympic weightlifters. So they went down a weight class, yet they lifted the same, so they're generating more power. Heart, it's carbohydrates that elevate cholesterol. It's carbohydrates that elevate blood sugar, that elevate triglycerides, that ultimately elevate cholesterol. Watch your simple carbs. Watch your carbohydrate intake. There's essential amino acids and protein. There's essential fats. There's no essential carbohydrate. So without question, watch your carbohydrates if you're worried about your heart health. Brain. Brain's made up to about 70% fat. I don't know who told anybody that carbohydrates are the best way to fuel the brain. Fat is the best way to fuel the brain. You want to fuel the brain with fat because it's a much better energy source. It's 2.25 times better energy source, fat, than carbohydrates. Also, ketone bodies, when you're in ketosis with beta-hydroxybutyrate, produces 22% more ATP. So without question, a high-fat, low-carbohydrate diet is a great choice, the best choice for any kind of brain function, and especially if you're concerned or suffering from neurodegenerative disease. Neurodegenerative disease like Alzheimer's, post-concussion, Parkinson's, truly going to benefit from a high-fat, low-carbohydrate diet. Here we go with the beta-hydroxybutyrate signaling. So we said it inhibits NLRP3. Thanks, Steph. NLRP3, she's laughing, inflammasome. It's one of the biggest inflammatory pathways. It's a new inflammatory pathway. Are we still live? Terrific. Whoever was calling, I will call you back, I promise. I'm doing a live now. So a good beta-hydroxybutyrate blunts or inhibits the inflammatory pathways. In addition, by having a high-fat, low-carbohydrate diet, we have a decrease of reactive oxygen species. In addition, you get an increase in membrane health because these saturated fats and these unsaturated fats are great choices for membrane health. Membrane health is interesting in that carbohydrates don't help membrane health, they actually damage it. You want a lot of good fats like omega-3 fatty acids, which really lead you down a path of making the membrane, cell membrane, bigger and more fluffy, which is critical. If anything, omega-3 fatty acids are a critical element for overall cell membrane health, and they're going to be ingested in a high-fat diet, high-fat, low-carbohydrate diet. Additionally, we found that additional pathways associated with these ketogenic diets are anti-seizure, as we talked about, neuroprotective. In addition to that, you have a low insulin, so blood sugar, if you eat a lot of carbohydrates, come out, insulin comes out. Insulin is a very deleterious hormone. However, when you eat fat, you don't release a lot of insulin, so you get a decrease in insulin, and signaling that in inflammatory pathways are decreased. So again, fat is your friend. It is not your foe. Not only is it good for cell membrane, good for your brain, good for your heart, and additionally good for muscle, it's also health promoting because it's not damaging anything. Just avoid, again, once again, those trans fatty acids. You're also going to have what we call a decrease in appetite. Fat gives a feeling of what we call satiety. Satiety is a feeling of fullness. That fullness comes from nutrient fullness. In addition, it has a positive effect on brain hormonal functions because it increases fat, something called leptin. Leptin gives you that feeling of fullness, whereas when you eat a lot of carbohydrates, it stimulates a brain hormone called ghrelin, makes you hungry. As we cover everything on this side of the chart, let's go over here and take a look of what the effects related to lower postprandial glycemia and insulinemia is. So essentially, by decreasing your carbohydrates and increasing your fatty acids, you're getting a better anabolic signal and a decrease in the collection of adipose tissue. So again, you're not putting fat down, you're actually able to build muscle. Many, many different studies are coming out in the last 6 months about how eating fat with protein is enabling you to get jacked, whereas the carbohydrates aren't, once again, because they're releasing and increasing the IGF and also increasing insulin. Finally, you're also avoiding what we call metabolic syndrome. Metabolic syndrome is the precursor to diabetes or prediabetes. You're not going to have a high incidence of metabolic syndrome if you don't eat carbohydrates and you consume fat. Finally, you're also going to see a better ratio of HDL, happy, the good cholesterol. So most people don't understand from fats, you're going to get a lot of good cholesterol, HDL. You're also going to get a decrease in LDL, the adverse for health type of cholesterol, L, lousy, low dense lipoproteins. So that's going to also decrease. Triglycerides are going to be on the decrease because triglycerides really are the body's response to an increase in carbohydrates. And finally, you're also going to have, maybe the biggest thing that I like to talk about, is a decrease in chronic inflammation. So without question, all the diets that we talked about before, all diets now should be low carbohydrate, high fat, not trans fat, good quality protein. The only thing you could say that you would want to supplement definitely with a ketogenic diet, some things you may be missing, would be fiber. So always you want to have a lot of fiber. Fiber keeps you more regular, and magnesium. Because if you cut any kind of fiber or vegetables out, you're going to be low in magnesium. So ketogenic diet, the two things you want to start supplementing with are, once again, fiber and magnesium. Do you got anybody screaming at us, saying hello? Any shout outs? We're real quiet. Tuesday before turkey. Nothing? Okay. So a couple of people asked me some questions. Wow. A lot of stuff that you're going to be covering. Showed this to a few of my patients. Showed this to a few of my doctors. How does it pertain to me? Well, number one, the best way to start is really easy. No gluten, no processed food, no sugar. Decrease your dairy, any kind of nicotine, artificial sweeteners. Start looking for fat. You know, if it walked on the earth, it was grown on the earth, it's a great choice. Thanksgiving is Thursday. So what do I recommend? Well, obviously, you know, people don't have a Thanksgiving breakfast, not that I know of. So here's a good breakfast for everybody to consider. Have some eggs. Have 3 eggs, have 1 or 2 yolks, a little olive oil, and an avocado. Great breakfast. Now, what about Thanksgiving? Typically, what do we have? Some form of protein. That protein probably being, you know, dark or white meat turkey. The dark meat turkey actually has more nutrients, has a little bit more fat. The white meat's a little drier, doesn't have as many nutrients. Either one is great. You can mix up your turkey. You have your protein. Well, most people traditionally want to have stuffing. Well, what kind of stuffing can you have? Well, the typical stuffing has a lot of carbohydrates. You might want to change that. So what we're seeing a lot of people make is avocado stuffing and wasabi stuffing. And what are you looking at me funny for? Wasabi's great. We have wasabi mash. You're not coming over. That's it, Steph. You're done. Safe way. No doubt about it. So that's a great choice. You have all your greens. You have all your vegetables. You could have your coconut shavings. So basically what you want to do is you want to sub out the stuffing and sub out your potatoes and start putting in your different guacamoles, avocados. You can have that a turkey. Make your stuffing out of something different. You have your desserts. Keep your sugars down in your desserts. It is Thanksgiving. Everybody should be thankful, but let's not bloat. Let's not eat gluten, and let's limit the amount of sugar that you consume. If you guys have any questions on this or any questions on a ketogenic diet, first of all, this just came out in Science Magazine. Dr. David Ludwig was a big author in this. He talks a lot about low carbohydrate diets. This was just recently out. There's a lot going on here. If you want a copy of the slide that was made, I'm happy to post that. Please ask, please comment, please share. Please look at our YouTube, Dr. Robert Silverman, and we also have our Instagram that we're doing a lot, Dr. Robert Silverman. Everybody have a great Thanksgiving. Dr. Rob, always yours in health.